Okay. Hi, everybody. Thanks for being here. Welcome to our second virtual Seniors Agenda Network Summit. I'm Marianne Warren, the Director of the Department of Aging and Adult Services for the County of Santa Clara. Our last Senior Agenda Network Summer was in August, and it focused on the digital inclusion of our older adults in our community. Tom Camber, our keynote, founder of Older Adults and Technology Services, delivered the keynote address from his boat in New York City about digital inclusion in the post-COVID world. I actually got a little seasick watching him, but he was great. We held our first Zoom panel discussion about bridging the digital divide in Santa Clara County with Richard Adler, who's here today, moderating our panel of experts, including Ryan Kawamoto from Senior Planet, Wesley Cheng, founder of Televisit, and Pauline DeLang Martinez of UC Davis. While this wasn't our usual summit with food and fist bumps, there were 140 of us gathered online to learn and take action. Today, I'm excited to learn about the California Master Plan on Aging that was just released a few weeks ago. I want to acknowledge Kim McCoy-Wade, who is the State Director of Aging, for leading this statewide effort during the pandemic to chart a course for us in aging in the next 10 years. During our time today, we will celebrate the accomplishments we've made since the last summit in August, learn about the Master Plan on Aging, and discuss how that plan will impact us locally through our panel of experts. Stay tuned, as upcoming events you will not want to miss will be announced, and a chance to vote on the focus of our next Seniors Agenda Summit. It is now my pleasure to introduce the 2021 President of the Board of Supervisors, Mike Wasserman, to give our welcome. Supervisor Wasserman has represented District 1 in South County since 2010. We so appreciate his support of all of our older adults and their needs. Welcome, Supervisor Wasserman.
Thank you, Marianne, and thank you for inviting me to speak today. As President of the Board of Supervisors, I'm committed to improving the lives of seniors in our community. Our county anticipates that 22% of our residents will be 65 and older in the next decade. We must work to create an environment for older residents with more accessible space, responsive services, and greater equity. The Santa Clara County Board of Supervisors has been a leading voice for our aging population, even creating a seniors agenda in 2011. In 2018, Santa Clara County became the first in the nation to have all the cities and the county join the World Health Organization's age-friendly global network. We also work with the national AARP Livable Cities. I'm excited to begin the age-friendly 3-year action plan during my term as president of the board. The age-friendly 3-year action plan assesses the community life of older residents and develops a plan to improve their overall well-being. This plan engages multiple county departments, and you will hear a discussion of that action plan today. Although the county is a large and diverse organization, we cannot alone meet the challenges before us. I look forward to aligning the recent California Master Plan on Aging with our local initiatives. The California Master Plan focuses on important issues like housing, inclusion and equity, as well as caregiving and affordable aging. All of us in this meeting today can work together on these areas to provide a better result. During this summit, you will hear from state, county, city, and community leaders about plans and accomplishments that give a context to our common mission. Today is an opportunity for each of us to become more than just informed. We must become active and engaged in creating a community that respects its older residents and allows for a life of dignity. Through coordinated action, we can achieve our goals. I'll close today with a quote from one of the founders of the feminist movement, Betty Friedan, who inspired many people throughout her life, writing about her experiences with aging in The Fountain of Age. And this is what she said. This is the quote I'm referring to. Age is not lost youth, but a new stage of opportunity and strength. I really like that. Let's work together to make this view of aging a reality. Thank you and enjoy the program.
Thank you so much, Supervisor Wasserman. I'd now like to introduce Project Manager for the Seniors Agenda, Martha Holland.
Hi, everyone. Good afternoon. Thank you, Marianne. Thank you for joining us today, everyone. Before we start, I did want to just give a little reminder that this meeting is being recorded, and the recording will be available after our presentation today. So you can access that. And also, please utilize the Q&A chat box that we have. It's at the bottom of the screen if you have any questions for our panel or any of our guest speakers, and those questions will be addressed during the Q&A portion of our presentations. Let's see. So again, thank you for joining us. And as you are all familiar with, typically on these virtual platforms, we utilize the use of polls to get a feel for the room. So before I begin today, I would like to launch our first poll. We had over 200 people register for this event, and I would like to see who's here today. So if you could please answer the poll, that would be great. Just want to see who's represented here today. So I cannot see the results of the poll. So I don't know if Sonia, if you'd like to give those results. I think those are available to you.
We still have people that are chiming in.
Wonderful. So I'll let you go ahead and address that when it's complete.
Yes, I will share the results as soon as people are done. We'll give people about, looks like people are just about done. So I'm going to go ahead and end the poll now.
Thank you. Great. So it looks like we have a majority of you are government entities, 40%. We have community-based organizations, advocates, community members, business partners, healthcare, others. So it looks like we have a nice variety of people here today. So again, thank you so much for joining us. So I wanted to just let you all know that in July of 2020, Age-Friendly Santa Clara County introduced the 3-year action plan to the county and to the Santa Clara Board of Supervisors. This action plan was adopted in August 2020 and calls for assessing the specific domains of life which impact older adults in our community. This plan was developed to improve the well-being of the residents of Santa Clara County. To further explain our 3-year action plan, I would like to introduce a woman who needs no introduction, Ms. Diana Miller. Diana Miller is currently the interim program manager for the Senior Nutrition Program of Santa Clara County. Since 2013, Diana has also served as the project manager for the Seniors Agenda. Diana and I have been working very closely together over the past 4 months in creating programs, workshops, and partnerships as outlined in this action plan. Diana will now provide you with additional information regarding our 3-year action plan. Thank you all again for attending, and we hope you enjoy the summit. Diana, it's all yours.
Thank you all, and welcome. I like the slide before when we got to see our last in-person and seen some familiar faces from that summit. But I want to just say our age-friendly 3-year action plan is part of our commitment to the World Health Organization for continuous improvement of our age-friendly communities. And this goes through a 5-year cycle of assessment, implementation of a 3-year plan, and then evaluation. Our assessment included a survey, 37 focus groups, 2 community conversations with over 100 agencies participating, and 11 logic model workshops, 1 for each domain. Even though our official 3-year plan had a delayed approval due to the pandemic, the accomplishments will be presented that later on will show you that we have been working to achieve our goals. The age-friendly community is divided into several domains for action, and the community has developed this framework, which is you see by the icons on the slide. So 1 is public spaces, social participation, housing, transportation, communication and information, dementia-friendly community, health and community services, volunteering, and civic engagement. And the last one is employment and finances. For the first year during the pandemic, we'll be focusing on the three domains of social participation, dementia-friendly communities, and our communication and information. And in the coming years, we will form other work groups to work on other domains as well. So we want you to take a look at the plan, which you see the cover sheet there that's on our websites. And then also, I don't know if I can show you this. No, because I have my screen on. Yeah, we have each domain is organized into a one-page standalone document. And on that, it has the background, our goal, the current age-friendly practices in our county government, highlights of the survey result, and our action steps, plus photos. So you can take each one out and just look at that if that's what your area of interest or expertise is. So I'm excited to bring the community together to accomplish all that we have planned in the next 3 years. So thank you all, and I will now turn it back over to the next slide.
I'm back again. Thank you, Diana, very much for that information regarding the 3-year action plan. So now I'd like to go over a couple of things. In spite of shelter in place, Seniors Agenda has had many accomplishments since our last summit in 2020. And so just a couple of our highlights from last year. So the first thing we'd like to talk about is our Healthy Brain Initiative. So on December 20, the Public Health Department hosted their Healthy Brain Initiative partner kickoff meeting to discuss brain health in Santa Clara County. Community partners came together to support cognitive health, elaborate on the concept of the Healthy Brain Project, and outlined expected accomplishments. We're excited to see what strides will be made in this important field of study in 2021. Next is the Adult Day Service Subsidy. We also call it ADSS. The Santa Clara County Department of Aging and Adult Services is offering a 100% subsidy for virtual adult day services to qualified residents. The Adult Day Service Subsidy was created to allow access and transportation to in-person adult day services, but the COVID-19 closures of these facilities resulted in even greater levels of need. The county works with providers to adapt to the new environment, allowing for flexibility and creativity to shape the continuation of the pilot. The program now offers remote services, including online instructor-led activities through Zoom, deliveries of meals, materials and essential items, and providing caregiver support and resources to families and caregivers. Once reopened, the providers are committed to offering the subsidy to both in-person and remote clients, opening the door to a broader continuum of care. Subsidies are still available. Please go to the age-friendly Silicon Valley website for additional information. Dementia Friends. Since September 2020, the number of Dementia Friends has increased by 300 participants. Santa Clara County has committed themselves to providing trainings to local partners to double the number of Dementia Friends in Santa Clara County. Our goal by the end of 2021 is to double this number from 1,000 to 2,000. Santa Clara County is currently partnering with Alzheimer's Association of Los Angeles to provide group sessions to our community to raise awareness regarding dementia by becoming a Dementia Friend. Dementia Friends USA helps community members become Dementia Friends by viewing a series of informational online videos and making a commitment to help. Please go to www.dementiafriendsusa.org and become a Dementia Friend today. Next is our Good Place to Start brochure. So this is a brochure that was created to provide basic information regarding services and supports for older adults. The latest update includes new information on the volunteer driver programs. You can find information regarding the expanded RIDE, which stands for Reach Your Destination Easily program, that is now serving Morgan Hill and zip codes in San Jose. Please visit our age-friendly Silicon Valley website to download a copy of the updated version of A Good Place to Start for additional information. Let's see, next, our age-friendly communication workshop. So we were busy the last 6 months. So in December, on the 18th of December, Rachel K. Bell, who's a volunteer coordinator at Next Village, San Francisco, discussed how public messages about older adults influence the reader's perception about aging. Rachel shared the age-friendly communication guide to over 70 participants to raise awareness about common stereotypes and journalistic practices that should be avoided to create a more accurate and positive media environment. Materials are available on our age-friendly Silicon Valley website under Communication Guide. And now finally, we have our digital inclusion work group. So another important domain under our age-friendly framework includes communication and information. Staying connected with access to timely and practical information is more important than ever, especially when considering maintaining active communication and support to our older adults in Santa Clara County. The Digital Inclusion for Older Adults Work Group has been meeting since October 2020 to discuss important information and ideas regarding what can be done to close the digital divide. I would like to introduce Richard Adler, member of the Senior Care Commission, chair of the Age-Friendly Cupertino, and a person who I consider a colleague, mentor, and friend. Richard has maintained an active role in the Digital Inclusion Initiative and is here today to explain a little bit more regarding the Digital Inclusion Work Group. Take it away, Richard.
Thank you, Martha. So I'll give a quick update on what we've been up to. So in August of last year, the Board of Supervisors approved recommendations from the county's Department of Aging and Adult Services, whose goal was to promote digital inclusion for the county's seniors. And one of the recommendations was that we establish a work group to pursue these goals. The work group has now held 4 monthly meetings via Zoom, and each time we've had a larger number of participants. We now have more than 30 people participating who represent a wide range of agencies, cities, nonprofit organizations, and service groups. Our top priority is to work toward the goal that was adopted by the Board of Supervisors to, quote, incorporate low-income older adults into all county digital inclusion policies, assessments, and evaluations. Another priority that we're pursuing is to create an inventory of the existing digital inclusion resources and projects in the county, which includes things like work by groups like Senior Planet at Avenidas, that's providing support for older tech users, and SourceWise, the Area Agency on Aging, which has recently given some initial grants for digital inclusion using funds from the CARES Act. And we also just learned that SourceWise has acquired several hundred Apple iPads and Google smart speakers that through the state Department of Aging, it's going to be distributed to seniors in the county. Finally, we're going to be developing a white paper on the state of digital inclusion in the county, and we'll be organizing 1 or more events to raise awareness of the issue. The work group will meet again next week, and anybody who is interested in participating, please either contact me or Martha Holland. Thanks, Martha.
Thank you, Richard. So now for our next portion of the presentation, I would like to introduce our keynote speaker, Amanda Lawrence. Amanda is the project director of the Master Plan on Aging. Hold on, I have to turn my camera on, sorry. Amanda is the project director for the Master Plan on Aging for the California Department of Aging. She has served as a strategist and program consultant on several projects at the California Department of Public Health, including launching the Healthy Aging Initiative. She has a great wealth of knowledge about the various initiatives, working groups, campaigns, and other activities that have occurred over the past 18 months in support and development of the Master Plan for Aging Initiative. Please help me in welcoming Amanda Lawrence as our keynote speaker regarding the California Master Plan on Aging. And just as a reminder, please enter your questions in the Q&A box located at the bottom of your screen. These questions will be addressed after the presentation during our Q&A session.
Hi, good morning, everyone, or afternoon, actually. Very excited to be here today. I'm honored to be here as well with our Master Plan for Aging. We're all stars, Fernando Torres Gill and Nina Weiler Hartwell, who were both had immeasurable impacts on the Master Plan for Aging through their participation. And I also want to congratulate Santa Clara County on your dementia-friendly and age-friendly networks. That's really exciting to see. And I want to learn more about your digital work group, and that communications toolkit looks fantastic. And it looks like we launched the Master Plan for Aging just in time for this summit. You know, we launched it just earlier this month. And so today I'd just like to go over the process, the goals, and our plan over the next 2 years to implement the Master Plan for Aging in collaboration with state and local partners. Next slide, please. So, of course, it's been a very, very long year for us and for our clients. And the master plan would not be what it is if we hadn't actually paused and taken some time to address the pandemic, of course, and to really take those lessons we've learned to heart and make sure that they are incorporated into the master plan. Of course, the pandemic has unveiled the disparities that we knew existed, but I think many people didn't know how strong and how perpetuating they have been. So our original launch date for the master plan was actually October for the executive order. But because of COVID-19, we did take a pause and we spent 2 months just on rapid response activities. And we had a 3-pronged strategy for that. We focused on information and assistance, ways to stay connected and engaged, just like the digital divide work group, preventing social isolation. And you'll see that has a strong presence in our master plan final product. And then we also focused on providing resources for friends and family caregivers. Many people who don't consider themselves caregivers became caregivers during COVID-19. And we launched the Stay Home, Save Lives check-in campaign to really encourage people to check in on the older adults in their lives, whether they be family members, friends, neighbors, or even strangers. Lots of fantastic work happened to help get meals and medicines and basic needs to older adults throughout California. This card you see up here on this slide, that's our Stay Home, Save Lives check-in resource card. And we actually sent that to 18 million people via the mail in collaboration with AARP. We sent those out in English and Spanish. We also created COVID-19 data dashboard to share the COVID response data the CDA has regarding meals delivered, information and assistance calls, long-term care ombudsman crisis lines. So if you have not seen that, that's on our COVID-19 page on the aging website. And of course, the work continues now with the vaccine rollout. So we're all very busy working to ensure that we get the most vulnerable and older adults vaccinated as soon as we possibly can. Next slide, please. So on January 6th, we launched the Master Plan for Aging with a press briefing with California Health and Human Services Secretary Mark Galley and CDA Director Kim McCoy-Wade. Luckily, we were fortunate to be joined by Senator Melissa Hurtado, Assemblymember Adrien Nazarian, and key stakeholder advisory committee members, including Nina and Fernando. And then the following Wednesday, we hosted a virtual summit. And if you did not catch that summit, it is recorded. It's 3 hours long. We have 3 one-hour videos on our YouTube channel. And at that summit, we were joined by Labor Secretary Julie Su, Cabinet Secretary Richard Figueroa. We had Housing Secretary Lourdes Castro Ramirez and several legislators who have been involved in the Master Plan for Aging process and been some of our biggest advocates. And it was a fantastic display of how much buy-in we really have across this administration and through our locals. That this master plan, it will be successful because of how much time we have spent with these cabinet leaders and different agencies to really build out a robust plan with bold goals, but also with a pragmatic approach. So please, if you haven't, check those videos out on our YouTube channel. And I also want to say, like, this slide is of our beautiful report, our print report that we've created. But the MPA is more than just a report. You know, it is a long-term vision, and we outline that on our website. So if you visit the website, you'll find the story of the MPA, the why and the how, and our plans for implementation. And you'll also find that we do have 2 printable reports. There is this glossy, pretty printable report, might not be so easy on your printers, but we also have a very plain text one, totally accessible, that you can print out and review that way as well. The print report and the website, they have the information is basically the same in both, but we wanted to offer different ways for people to review the material. On that website, you're also going to find that we have a master plan for aging local playbook. I'll talk a little bit about that in a few minutes. And we also have our data dashboard for aging, which we're really proud of. And I'll talk about that as well. Next slide, please. So of course, we all know how, like, why we got here. Aging is changing, and it's changing California. And so recognizing that, the governor signed an executive order back in 2019 to create a state master plan for aging. And these significant demographic shifts that we're seeing are going to have significant implications for California's future. These next 3 slides are graphs that we have available in our report. But essentially, Californians are living longer than ever before, and we actually have the 2nd longest life expectancy in the US at almost 82 years. However, there are disparities in that life expectancy. And so we have to be prepared to ensure that all residents have the opportunities that we need to thrive as we age. Next slide, please. So by 2030, 30%, over a quarter of Californians will be 60 and over, and by 2060, that will be 30%. That also means that we're living differently. The number of older adults living alone is increasing. It's at 1.8 million currently. Not necessarily a bad thing, but there are implications for that. We also have the most multi-generational households than any other state, multi-generational meaning 3 or more. And so there's cultural reasons for that, but there's also financial reasons for that. You know, housing is very expensive in California. Older adults are the fastest growing portion of Californians experiencing homelessness. So programs like Project Home Key have been invaluable during this time, and we'd like to see things like that continue. Next slide, please. Bear with me, it is allergy season for me, so I have some trouble articulating. So we have the most diverse older adult population than we've had ever before. And by 2030, non-Hispanic white older adults will no longer represent the majority of older adults in California. You can see them represented in the dark blue on that slide, that portion getting smaller and smaller over the years. So there's a lot of implications regarding cultural competency and responsiveness that we have to consider so that we can advance equity in aging. We've got 2 million older Californians who are economically insecure, and there are grave disparities within that. Black women being the most vulnerable to poverty. And we need to begin addressing these disparities throughout the life course. So I hope that you'll see within the MPA that we've really tried to center our plan around equity. Next slide, please. So how did we get here? Well, we had over a year of rigorous public participation and stakeholder engagements. So we had our stakeholder advisory committee, and they met over the course of a year. I believe they met at least 36 times, and that included the long-term services and support subcommittee, the research subcommittee, and we also formed an equity work group. And we formed that actually just in time, shortly before the pandemic stay-at-home orders. And this culminated in over 800 recommendations from these experts in aging and disability services from across California to the administration. We also had several roundtables within communities around California that were hosted by legislators who have been fierce advocates for master plan for aging and for older adults and people with disabilities in California. And then in March 2020, the Master Plan for Aging and the Governor's Task Force on Alzheimer's Disease Prevention, Preparedness, and the Path Forward aligned our efforts. That only made sense. It's a natural fit. And this allowed us to ensure robust and complementary recommendations to the governor regarding Alzheimer's disease and dementia that include research, public awareness raising, caregiving support, and more. We also have been working closely with the cabinet work group, with all 10 cabinets and a few other offices throughout the administration. They have been very enthusiastic about this plan. It's been wonderful working with our agency secretaries. It's been a kind of a bright light throughout the year to work on something so positive and so meaningful for everybody. You'll see that in our initiative. You'll see that we have initiatives that have been commitments that have been made to the Master Plan for Aging for throughout the next several years. And they will continue. We will continue to work with the Cabinet Work Group on implementation and oversight. And of course, COVID-19 has influenced and impacted the Master Plan for Aging due to all of those lessons that we have learned. We had a public survey that actually asked people how COVID had impacted their lives. And of course, no surprise, the isolation and the lack of internet access and the value of having internet access came up first and foremost there. And of course, being able to access food and medication. Next slide, please. So the Master Plan for Aging, I want to emphasize, it is for people of all ages. It's not just for older adults. It's truly about creating a very livable state that people of all ages can thrive in. And so we came up with 5 bold goals for 2030. And throughout that stakeholder process, we did work with a 4-goal framework. It did morph into 5 goals for the final product. So in case that might look a little confusing, that's what happened there. And I will go through each of these goals throughout the next few slides. So next slide, please. So our goal 1, housing for all ages and stages. That means that we will live where we choose as we age in communities that are age, disability, and dementia friendly and climate and disaster ready. So we had a target for this goal of creating millions of new housing options to age well. And for each of these goals, if you look in the master plan in our local playbook, we also highlight local models, organizations across California who we feel like we can look to learn. And we also are always open to hearing about other fantastic work going on across California. And I'll talk a bit more about that in the local playbook. So our local model for goal 1 is Age Well San Diego. We think they're doing a fantastic job. They've been doing a lot of work on accessory dwelling units and just other ways of making a more age-friendly communities and housing. And so strategies within this goal area are going to include not just the house itself, of course, modifications so that people can stay where they want to live for as long as they want to and avoid institutionalization, but it's also about your community. Do you live near coordinated and accessible transportation? Do you have access to parks and recreation? And is your community environmentally friendly? Is it ready for climate change, and can it help mitigate climate change? And then also we want to ensure that everyone is prepared for disasters. Wildfire seasons are just lasting longer and longer. So there are several initiatives in this, several strategies and initiatives within this goal area that address those topics. Our goal 2 is is Health Reimagined. And that means that we will have access to the services we need to live at home in our communities and to optimize our health and quality of life. And our target there is to close the equity gap and increase life expectancy. And a couple of local models we've chosen to highlight at the master plan are the Inland Empire Health Plan and Partners in Care Foundation's work that they do with healthcare plans. So this goal area is really about bridging healthcare with home, expanding access to services. We've included larger public health initiatives in there as well, including awareness campaigns and those targeting Alzheimer's disease and dementia. Next slide, please. So goal 3, inclusion and equity, not isolation. We will have lifelong opportunities for work, volunteering, engagement, and leadership, and will be protected from isolation, discrimination, abuse, neglect, and exploitation. It's a big one. Our target there is to keep increasing life satisfaction as we age, and we've selected the local model of Purposeful Aging LA. Within this goal area, you'll see strategies addressing elder justice, digital divide, continuing equity and anti-ageism work that CDA has launched, opportunities to work and volunteer and engage across generations. If I do want to give a quick plug in this goal area, CDA has begun hosting Ensuring Equity in Aging webinar series. It's every first Wednesday of the month. So we have one next week. It's culturally informed policy and programs with and for Black elders. And we've had a fantastic turnout for those webinars. It's clearly content that's needed. And so we really focus on creating an opportunity for providers to share best practices, tips and recommendations and resources with other providers to ensure that we're creating inclusive programs for older adults and people with disabilities. And we also have on our website an Equity and Aging Resource Center. So if you haven't been on that, please check that out, full of resources regarding addressing equity, discrimination, and inequities in aging services, and especially during COVID. So our goal 4 is caregiving that works. And our goal there is to be prepared for and supported through the rewards and challenges of caring for aging loved ones. And like I said before, so many people don't even recognize that they are caregivers. And the COVID has really put a spotlight on the need to truly support caregivers. We have a goal here of 1 million high quality direct care jobs. And our local model that we've chosen to highlight is Contra Costa County's Ombudsman, their healthcare career pathways, fantastic career development and sort of career pipeline program that they've created there. So in here, you're going to find strategies that promote high quality, valued, and well-paid jobs with professional development and other supports. But we also have in this goal area supports for friends and families who are caregiving, including paid family leave and providing in-language supports and expanding the virtual care resources and capabilities for people. And then in goal 5, we have affording aging. We will have economic security for as long as we live. Our target here is to close the gap in and increase elder economic security. And our chosen model for this goal area is San Francisco counties and cities' COVID-19 response and their Project Home Key and meals expansion work. In this goal area, you'll find strategies about promoting people's ability to save for retirement, preventing homelessness, and hunger and poverty amongst older adults in California. Next slide, please. So I'm not going to read this slide to you, but it does demonstrate all 23 strategies that we have throughout the 5 goal areas, and you can explore all of those on the website and in our local playbook. Next slide, please. So what's next for the master plan? We are working with the 10 cabinet agencies, and we have a lot of strong partnership with local leaders, private sector, federal government, and our stakeholders from our work group and more to launch over 100 initiatives within the first 2 years. We have actually outlined 132 initiatives in our master plan report, and those are just for the first 2 years. And you'll see when you look on the report that every initiative has the lead agency next to it and supporting agencies if those are there as well. So we're digging into those. We're developing them right now, developing our work plans, and really we're ready to launch several of them. A couple of things we're going to do in the short term, because we are kind of in the take a breath, step back from the planning and development phase and really build a robust plan for implementation. We are creating an Elder Justice Coordinating Council, which will include members from across the cabinet, but as well as leaders from the non-governmental organization and advocacy networks. California is going to join the AARP network of age-friendly states. So I started filing the paperwork yesterday. We're excited. That means California, I believe, will be the 7th in the country and the 2nd state in the West to join the age-friendly network. And we're thankful to Assemblymember Rubio. Her AB 1118 actually from last year directed the state to consider joining. And so I will be taking the lead on that and ensuring that we get through that process, and very excited to work with AARP. It was one of our top requests for the master plan. We are also going to focus on research and data and really ensure that we can create networks with university systems and the state, so that people can access the data they need to drive their projects and programs and drive sound policy. The governor is going to appoint a senior advisor on aging, disability, and Alzheimer's. And that will also advance cross-cabinet initiatives and partnerships between the government and other private and philanthropic sectors. And that person will focus on closing the digital divide, transportation options beyond driving, and caregiving workforce solutions for Californians of all ages and beyond. And then, of course, I'm sure everyone has seen the governor's proposed budget. Very exciting to see investments in several areas that touch on the master plan for aging, including support for the Aging and Disability Resource Connections Network, several $1 million for Alzheimer's disease projects, including research, caregiving, a portal, several things there. There is some money for the master plan for aging for our implementation. Very grateful for that. And housing, that's a big deal. Some housing investments for older adults, and then geriatric workforce, caregiving, falls prevention. So excited to see those, all those initiatives being proposed, and looking forward to continuing the work in the future. Next slide, please. One of our next steps is to create a new stakeholder work group. It's called Impact, Implementing the Master Plan for California, Master Plan for Aging in California Together. It's so hard to say, just call it Impact. And this committee will have several of our stakeholder advisory committee members present on it, as well as some new members. And we're going to name those later, maybe early this spring, later this winter. And they're going to advise the administration on the implementation of the master plan for aging. We're also going to continue stakeholder committees that are going to focus on long-term supports and services, ensuring equity in aging, and elder abuse and justice. So we'll have a lot of work happening with lots of meetings quarterly. They'll all report to the Impact Committee, who will really move forward and ensure that this is truly a master plan that's implemented across California by every agency and department. Next slide, please. So that was the master plan on the state level. And we also created a local playbook. And if, like, the work on the ground is so important. The work that you all are doing is so important. So the state has a role in the master plan, but truly we know it's what happens on the ground is really what matters. And so we created this playbook, and it includes 7 different plays to assist state and local governments and also communities and then the private and philanthropic partners to build environments that promote age friendliness and disability friendliness across California. And so whether it's a small project focused on one specific item or issue, or you want to build out your own master plan for your community, much like Santa Clara has with your age friendly network, there's something in there for you. It's on our website, but we also created a PDF slide deck. So you can download that and present it if you'd like as well. But anyway, there's tons of resources on this website through this playbook. We share local models on there. And then we also highlight local data. And play 7, though, is share your story. And so one of my goals with this playbook is to really create a network. I mean, in my dream world, every county in California would have a master plan for aging, and we'd have this coordinated resource sharing, information sharing network. So we asked people to share their stories in play 7 on our website. So I'd love to hear from Santa Clara County what you think is going really well, and we can highlight you on the website and in our playbook. But play 2 is explore local data, which brings me to our next slide. Our data dashboard for aging. Play 2 is get to know your local data to drive action. And so this data dashboard that we're so excited about, we created with the California Department of Public Health Let's Get Healthy California team. Let's Get Healthy California is our state health improvement plan. They have a fantastic dashboard on there. And so we thought, let's piggyback on that. Let's make sure aging is highlighted on this state health improvement plan. So with the help of West Health Institute, we have created this dashboard that is in alignment with all 5 of our goals in the master plan. And then it also shares just basic demographic information. So if you log on there on that front page, this is what you'll see up top. You can select which area you're interested in, Health Reimagined. And then if you click on that, you'll find all sorts of data indicators related to the strategies that we've selected for each goal area. And then if you were going to scroll underneath this section of the page, you'll find our demographic data dashboard, which is broken down by county. All of the data is available by county. So we hope that it's truly a wonderful resource that you can rely on to really drive action within your communities and do informed policy and program planning. This is version 1.0 that we have up right now. We're continually enhancing the data dashboard. We are still waiting on some data sets for some of our goal areas and strategies, so it's not comprehensive and aligned with every single strategy we have. That's just the limitation of the data available at this time. But we will continue to improve it. It's version 1.0. We hope to have version 1.2 available by the end of February, and then hopefully version 2.0 by the end of the year. And we're always happy to receive feedback on this in any of our products. And we will be doing some user testing on our dashboard. So if you'd like to be involved in our user testing, I'd love to connect you to our team. And then finally, next slide. I'm just very grateful that you've all had me join you today. We've been through so much this year, so have the people that we've served, and I just want to encourage everyone to take time to care for yourselves, whether it's just unplugging, meditation, yoga, reading a book. Just take some time for yourself, because I know we can't serve others if we are stressed, as we have been over the past year, and it'll all be for the benefit of yourself and for the older adults of Santa Clara County. This master plan is a true opportunity for California to be a national model for aging. We've had several states already reach out to us to ask about our process and the development of our products. So it really is an excellent opportunity to highlight what we're doing here in California. And everything that we do, from what's going on locally to what's going on at the state, can have a ripple effect across the entire country to create an age-friendly United States. So I encourage everyone to visit our website to check out the Master Plan for Aging. You can sign up for our newsletter there. We send out 1 to 2 newsletters with MPA updates and webinar invitations a week. So much going on, but you can also check out the updates on our website as well. That concludes my presentation. Thank you.
We actually have a few questions for you.
Sonia, let me do this, because we only have about 4 minutes left. So on the questions, there were some that I think the panelists could answer, as well as you. So the first one that came up was, what kind of plans or resources are there for the LGBT plus older adults? And I just will put a plug in that at our county, we have a survey that's going to be going out in the next few months to really take a survey of our LGBTQ older adult community. And so we're going to be doing that locally, but is there anything in the master plan to address this community?
Yes, actually, and I also want to mention that a couple of months ago, or maybe it was last month, we did a webinar called The Culture of LGBTQ Older Adults, and it was our most highly participated, attended webinar that we've done so far. So clearly there is a need for a lot of resources in there. And a lot of that you'll see throughout the master plan as really the equity and inclusion component. We're still working through specifics of that. And I was actually thinking, if you want to save these questions, I could probably answer them afterward and get back to everybody. And then I know our panelists can probably answer some as well. And it looks like I've already answered others. And I guess there's a lot of requests for links to the websites. So I can send you those links, or I'll send you those links.
Okay. So great. And then the other one is, how has the governor supported the initiatives in his budget? Do you have any specifics of, or where to find that in his proposed budget?
Yes, I went over a few items that he has already called out in his budget. And then let's see, I could tell you that we've got, $5 million for the master plan for aging implementation, which is fantastic to actually have staff to really focus on housing, equity, and health policy. The California Department of Aging is going to be augmenting our staff to really be able to address these issues in-house and also coordinate across cabinets and departments across the Health and Human Services Agency. So we saw he has $7.5 million in there for Aging and Disability Resource Connection. Alzheimer's disease got $17 million for public campaign, for standards of care for healthcare workers, and grants to help communities be dementia friendly. I know there's more items in there as well. There's money to expand facilities to support housing, let's see, there's 3 million to increase geriatric care workforce. You'll see a lot of that in the master plan, is we want to not just increase the geriatric workforce, but diversify it, ensure that people get to see doctors who they feel comfortable with, who look like them. That senior advisor on aging, disability, and Alzheimer's is in his budget. And then there's 17.5 million for senior nutrition. That would happen. Family caregiving and support services has several million. And then there is a few million for falls prevention. 6 million for CBAS. MSSP has received some. So there's a lot in there for older adults and master plan related activities.
Okay. And then the last question, I think we will have you answer some specific ones. We'll send you those questions to answer for people. But what about universities and what's their connection to the master plan?
So we've had a great relationship and have had several professors and researchers on our advisory committees, and that we hope to continue that, and specifically around research and data. So we are going to be forming a research consortium for aging, and UC Berkeley and Stanford will definitely be a part of that process. And we will work with our, at the state, there's been a lot of work to modernize our data, how we share data. So it's a great opportunity. We're hoping that the aging data can kind of be a case study, like the new case for their new data sharing and collection models. So there's promising work happening there.
Okay, well, thank you. I really appreciate you coming. Amanda had to go, her house is out of electricity, so she had to go to some other shelter to do this, considering her mom's house. But we really appreciate you being with us today and sharing, and we look forward to, as a county and organizations, being part of the master plan and coordinating all our efforts together. And so
Thank you.
Yeah. So we will ask you to, we will be posting the link, and we'll be posting the link, and also we'll be posting your PowerPoint on our websites, as well as there will probably be an email that goes out to participants, because people are asking how they can, find out more. And then also for those who ask really specific questions, we'll have Amanda answer those, or they might pop up in our Q&A with our panelists. So thank you, Amanda. I wish we could give you a rousing round of applause. I haven't figured out how to do that on Zoom yet. But thank you so much. And we'll move on to the panel to hear what they have to say. And I want to start by introducing the moderator, Sherry Burns. And Sherry is the Executive Director of the Silicon Valley Independent Living Center. And she's been doing that job since 2015. She is a native of San Jose and has worked in independent living disability services for over 35 years. She's has been on, serves on many local, state, and national boards. I counted 6 in her resume, including the chair of the Aging Services Collaborative for Santa Clara County. And the last time I saw Sherry was at a movie theater for a sing-along presentation of Grease. So hopefully we can meet again soon, but it's been a long time. And we appreciate Sherry's involvement both in the disability community and the aging community. So Sherry, I'll let you take over as moderator and introduce our panel.
Thank you, Diana. Yes, we have to get to a movie again sometime soon. That was a lot of fun. And thank you, Amanda, for the wonderful summary of the 5 main goals of the state's master plan for aging. And now it's my pleasure to introduce our esteemed panel of presenters, with whom all of our participants today will be able to ask your most pressing master plan for aging questions after their opening remarks. Please, again, place any of your questions in the chat box at any time. First, we have joining us today, Dr. Nina Weiler-Harwell. Dr. Weiler Harwell is an associate California State Director, Community for American Association of Retired Persons, fondly known, of course, as AARP. And Nina has over 20 years of experience working in aging advocacy with AARP. In 2019, Nina was appointed to the Stakeholder Advisory Committee, about which Amanda spoke, and the Long-Term Services and Support Subcommittee for the Master Plan for Aging, where she has worked to ensure that AARP caregiving, LTSS financing, and age-friendly priorities become part of the final recommendations of the Master Plan for Aging. Dr. Weiler Harwell earned her MA and PhD from the University of Southern California in political science. We also have joining us this afternoon, Assemblymember Ash Kalra. Ash was first elected to the California legislature in 2016, representing the 27th district, which encompasses approximately half of San Jose and includes all of downtown San Jose. In 2020, he was reelected to his third term. Assemblymember Kalra is the chair of the State Assembly Labor and Employment Committee and also currently serves as a member on the Housing and Community Development, Judiciary, Transportation, and Water, Parks, Wildlife Committees. Also, we have this afternoon on our panel, Dr. Fernando M. Torres-Gil. Professor Torres-Gil is the son of immigrant farm workers, was born and raised in Salinas, California. He earned his PhD in social policy, planning, and research from the Heller Graduate School in Social Policy and Management at Brandeis University. He is a professor of social welfare and public policy at UCLA, director of the UCLA Center for Policy Research on Aging, and an adjunct professor of gerontology at USC. At the state level, Professor Torres-Gil was appointed by former Governor Arnold Schwarzenegger as a delegate to the 2005 White House Conference on Aging, and recently appointed by Governor Gavin Newsom to serve as an advisory committee member developing the Master Plan for Aging. Now to our wonderful three panelists. Who drew the Powerball number to start us off? Perhaps Nina, would you like to start?
Sure, I'd be delighted to. Just some introductory remarks. So AARP is a membership organization of over 3.3 million Californians, 50 and over in California. We are also the North American affiliate for the World Health Organization, for the network of age-friendly states and communities. We're so delighted that, first of all, Santa Clara, I don't know if you saw me applauding before. I was aware that every city in Santa Clara County has joined the network along with the county. Also delighted that the state is in the process of joining the network, making it, yes, the 7th state to become an age-friendly state. And we stand ready and able to provide technical assistance to the state as needed to build out its age-friendly action plan. And I have had the honor of working with Dr. Fernando Torres-Gil on the Master Plan for Aging, where he provided sage vision, advice, and knowledge that fed into our recommendations. And of course, Assemblymember Kalra, we've worked with on so many things, caregiving, paid leave, as well as the long-term care benefit. So thank you for having me here today.
Good afternoon, everyone. I guess I'll go next. I'm Assemblymember Ash Kalra. Great to be joined with these wonderful panelists, and great to see you, Sherry, as always. It's always great to connect with our Santa Clara County community, especially given the work that the county does and all of the agencies that partner with the county on aging. I know that here in Sacramento, so often Santa Clara County is referred to as a model in so many ways in how it approaches the global issues of aging, not from one silo or the other, but really looking at it in so many different ways that I've appreciated. It's made me a better legislator for certain in terms of advocating for aging community, but also I think it really helps the state see what the possibilities are. And when we look at the Master Plan of Aging, you may have noticed in my intro, it did not mention aging and long-term care. I was on that committee for the last 4 years, and I chaired it, of course, my first 2 years. And during my time on that committee, including during my time as chair, with many of you as well as other advocates around the state, we really pushed for a master plan on aging, recognizing that the state, it had been decades since they'd done a deep dive, and our community, our state is very different now. And frankly, our elderly population is very different. Issues regarding aging are very different now, whether it has to do with technology, whether it has to do with far greater independent living, but the requirement and need for support and socialization in this age of technology. And so it's so wonderful to see where we are now. After these few short years I've been in the legislature, to see the work that's been done. And it's great to hear from Amanda detailing some of what we have in store in terms of the master plan of aging. And I agree with her 100% that no matter what the state does, it's all of you on the ground, the county and the agencies that work with the county that implement it, that tell us what's working, what's not working, that helps us in terms of the budget and where we should be allocating our resources. And so we can certainly set parameters and set the stage for success, but success happens at the ground level, happens with our counties, our cities, our nonprofits and other agencies and care providers as well. I do want to highlight a couple of things. There was a question regarding the budget, and some of these might be a little bit of a repeat, but I don't want to go, there's actually quite a few things in the governor's proposed budget that I fully support, that will support either specifically the master plan for aging or issues regarding aging. And Amanda mentioned the $5 million for as a placeholder for master plan for aging, as well as the $17 million on the bold and equitable path forward on Alzheimer's. And there's a number of different categories those resources go to. Everybody that knows the work I've done, I absolutely have and will continue to work to support those suffering from Alzheimer's, their caretakers, as well as research regarding that and other mental health related and brain health related ailments. There is an Office of Medicare Innovation and Integration that the governor would like to start, which I think is fantastic, to establish that office. And there's also resources to expand facilities to support housing, including in adult residential facilities, residential care facilities. I'm continuing my bill I've been working on, I think this might be the third or fourth year, regarding having higher standards for nursing homes and other type facilities. I think we've gone really too long without ramping up and putting more clear standards, especially when there are deaths at the facilities, to make sure that we have the highest quality of care in all of our facilities here in California. And the last couple of things I'll mention, and we can go to the conversation, $61.5 million for support services and family caregiving. That's absolutely critical, as well as $17.4 million for residents and long-term care facilities and a long-term care ombudsman. And so those are just some kind of quick hitters that I think show you the commitment, not just from the governor, but from the legislature as we work with our partners to ensure we get resources to all of you, to the counties and those doing the work on the ground level. Again, a lot of the things I've advocated for, I've learned from you. So please continue to give us feedback over the course of this year and in the legislative years ahead, so we can make sure that we're doing everything we can to really create a vibrant community for all ages, and in particular for our elderly and aging community. And last thing I'll say, I wasn't sure if I was going to make today because we did have a special session today. It was for us to vote to approve one of our wonderful seniors in the legislature, Dr. Shirley Weber, as our next Secretary of State. And I think she's an example of what our elderly, how capable and how passionate and committed they are. And so I think she's a wonderful example for everyone, that as you age, not only can you do it gracefully, you can do it with power, commitment, and striving for justice.
Thank you, Assemblymember Colrun. Thank you for sharing the very, very new, great news with us. Appreciate that too. Professor Torres-Gill.
Oh, thank you very much. It's a real pleasure to be back in Santa Clara County as one of my homes, although virtually. And first to commend really the two experts that spoke today, Amanda and Nina, who will share more of her comments. They really have all the details. And Assemblymember Cara, thank you for your leadership there in San Jose and throughout the county. And I'll just say this, when Diana Miller ever reaches out to me to ask to do something, I always say yes. So I thank her for her support there in the county. Let me just first commend Santa Clara County for its amazing leadership and its innovative approaches to aging and to older adults and to persons with disability. And it's really exciting to know all municipalities in Santa Clara County are now part of the age-friendly initiative. That's quite an accomplishment. And you're right, Assembly members, you can be proud of your county and your city. They are showing the way for much of California and for much of the state as well. And I take personal pride in part because I'm from there and much of my family lives in Gilroy and Morgan Hill and San Jose, but my greatest pride in Santa Clara County is our San Jose State Spartan football team, who made it all the way to a bowl game. And there is an aging component to their great football record that fits in with one of the key concepts of our master plan on aging. And I'll speak to it in a moment on what we call the lifespan perspective. San Jose State had its best record in football since 1939. And when I mentioned that to my students at UCLA, they're Gen Z, they were commending me and saying, it must have been fun, Professor, for you to be there on campus in 1939 to cheer on the Spartans. And I didn't have the heart to tell them I wasn't quite around in the late 30s, but the lifespan perspective. But in either event, it's great to be with all of you. I'll just make a few comments to build upon what Amanda and Nina have shared and will share. First of all, that this master plan on aging was not just about older adults. It was about persons with disability and those who are older adults and those like myself as a disabled person, now 72 years old, aging with a disability. And so we were very involved with the disability rights group with Andy Imparato, who's one of the leaders there in the Bay Area. And so I just wanted to stress, this is about all of us that will face some type of disability throughout our lifespan. Secondly, since I have been around since, at least my students think I've been around since 1939, I do have a historical perspective which reinforces, I think, the tremendous benefits that will accrue with this master plan on aging. This is my third participation over the last 30 years where the state of California, the state legislature and the governor's office have attempted to plan for an aging California. The first two, maybe 15, 25 years ago, were worthy efforts and did good things. But what makes this current effort quite different, and therefore, in my opinion, this master plan on aging, as you have heard, will have real concrete benefits for all of us today and over the next 5 to 10 years. And the difference is, first, this tremendous collaboration by all the key players throughout the state, all sectors, whether it's providers, industry, advocacy groups, professionals, academics. It had the direct buy-in from the governor's office, and we thank Governor Newsom for his full support, the Secretary of Health and Welfare, Mark, and the Director of the California Department on Aging. And it had the support of the state legislature. And Assembly member, you're certainly one of those that have been cheering us on, and you supported us during the budget negotiations on many of our recommendations. And it has the full buy-in from the cabinet, the many other directors throughout the state government. And so that makes this truly both value added and with tremendous ability to have an impact. One of the concrete manifestations is the governor's budget. And there is a website, by the way, from the California Department on Aging that will list the specific budget requests that the governor has made that dovetail with specific recommendations from the master plan on aging. And it's just so impressive that the governor's budget, with what we hope will be the full support of the state legislature, will do great things for older adults, persons with disability, and those that are aging with disability. I will just end with these concepts, which I think is very important in terms of where California leads the nation on these issues. we, for the first time, incorporated certain concepts, and I'm speaking now as an academic, certain concepts that will change the paradigm for how California will respond to its aging and its diversity. First, that lifespan perspective. We now all recognize that it's not enough to address the needs of persons 65 and over, or 85 and over, or even 50 and over, because much of the challenges, which have much to do with health and retirement insecurities and challenges, occur earlier in life. And therefore, we need to also look at younger populations and invest in their health care, in their ability to earn a decent income, in their housing and transportation, because we know younger populations that do well will do well when they are older. And we see that with the pandemic and the need to now address communities of color. Those with the greatest challenges are Black and Brown communities, communities of color. And they've been impacted in large part because of the health determinants that have made it so difficult for them to survive this pandemic. So we know in this master plan that we're talking about older adults, but we are also talking about our children, our grandchildren, and other people's children and grandchildren. So we hope with this conceptual framework and the incorporation of this equity lens, addressing diversity, equity, and inclusion, especially because California is now a majority minority state. There are no majority populations. It's extraordinarily diverse, and we represent where the country will be by 2045, by 2050. So incorporating these new concepts or frameworks, we believe will add to the benefits of the many things that we have recommended. And then just lastly, let me just say that there is active participation by the members of the master plan to work on the different goals that have been outlined to make sure that things come from it, including looking forward to a special advisor in the governor's office who will help kind of lead the charge. So it was an honor to be with this group, and I turn it over back to Sherry.
Thank you. Thank you, all three of you. And thank you for Professor Torres-Gil for explaining the paradigm shift with the framework, because it is a misconception that I think a lot of people have with regards to this being a master plan for aged or older adults. And in fact, it is looking at our whole lifespan perspective, that we are all aging from the time we were born. And this is a plan for all Californians. And also the framework that has first and foremost the equity lens as well. So thank you all three. We have questions that Diana is going to help field for each of you to answer. We have about 8 to 10 minutes left. I'm just going to start us off with Nina asking you a question. That since Santa Clara County has already joined the network and developed a 3-year age-friendly action plan, how might Santa Clara County and the cities that are within the county use the MPA local playbook to build upon our current disability and age-friendly action plans?
So certainly that local playbook can certainly be used as an additional lens to look at the age-friendly action plan and determine areas where for additional opportunities for action. It also is really there to help inform some communities that are not part of the network, though, I may say. So I know we had a question in chat about communities that are under-resourced or what kind of resources there are available. And for the individual that asked that question, I have put that out to some of my internal partners that we can get back to you. But that local playbook is really a way to look at your own community and use lower cost, maybe lower capacity mechanisms to, as was stated earlier, perhaps tackle one issue in the community that really deserves attention and begin to build out slowly towards a plan. Really, the idea of the state joining the network doesn't mean every community has to join. It is optional. It is a flexible framework communities don't have to build off of all 8 or 9 domains to build out a plan. So really just encourage, again, Santa Clara, who we are quite aware is doing great work. We have an office in Santa Clara County in San Jose that is working with you all on the action plan, but looking at that and seeing where maybe could we improve, are there other opportunities, and again, going further out to smaller communities that don't have the same resources. Maybe there's some hesitance to join. How can you use that local playbook to create your own mini master plan? And ARP is, again, here we provide free technical resources to communities that are looking to join or seek ways to improve their age-friendly status within their own communities.
Right. Thank you so much, Nina. I have a question that came in from Bob Brownstein. What evidence is there that private firms will provide high quality caregiver jobs with good compensation and career paths? They haven't done that as of yet, despite massive turnover in the industry. Isn't it time for the public sector to be creating assisted living facilities and SNFs?
My short answer to that is yes. I agree 100% with that. And especially speaking at chair of the labor committee, the kinds and quality of jobs that are being created in some of these private facilities, not only do they not uplift and support the workers, they don't exactly encourage folks to go into the business of caring for those that need care. And I absolutely think that that both things need to be done. We need to really empower the workers that are working in these facilities in terms of education, training, and once they're on the job, make sure that they're able to bargain and fight for high quality pay, benefits, and certainly job quality and a healthy environment to take care of those that they're responsible for taking care of. But I also think there's absolutely an opportunity, and I think Santa Clara County is certainly a place where can take a lead on this in terms of creating public facilities and public long-term care assisted living facilities. I think that even thinking about using, we have to break these silos of funds, healthcare funds, housing funds. Housing is healthcare. And so if we can think of ways to use funds that may be dedicated to one or the other and combine the both and create wonderful healthcare focused facilities that are high quality living facilities, whether it's skilled nursing or assisted living, I think that's a win-win. And in the process, we create really high quality jobs and a place that everyone can feel dignified in living in and working in.
May I
Thank you.
Well, Sharon?
Go ahead. Yes, please.
I'd like to build on those comments, and it's just a great question. First, I'm going to speak kind of personally here. The pandemic, among other tragedies that it has exposed, is both the uneven care that's provided between the for-profits and the nonprofits, and that we have for too long undervalued that home care, long-term care workforce. And one of my great colleagues and mentors, Professor Charlene Harrington at UC San Francisco, has brought out in stark relief with all the data that we have as a society pretty much abandoned those in nursing homes and especially in long-term care facilities, and especially those that are publicly funded through Medicaid or Medi-Cal. And we have not sufficiently regulated the proprietary for-profit industry, which essentially is in the business of caring for our most vulnerable elders, not to care for them, but to make money because it's a business for them. And we have to face that issue of how appropriate is it that we allow that kind of reason to get into this business. Now, one of the things we should recognize, the good news, we now have federal partners to work with us. And one of my good friends and colleagues, Javier Becerra, will soon be the Secretary of Health and Human Services. And I served, by the way, on the Biden-Harris policy committees, especially on the healthcare and long-term care. And I can assure you that both Secretary Becerra and this administration, not to be partisan, have very specific commitments to investing and improving the pay, the compensation, and the role of long-term care workers, and dealing with that tragedy of how we have allowed the nursing home, SNF, and long-term care facilities to essentially become warehouses that have put older adults at tremendous disadvantage, and the high rates of mortality in these facilities bring out that we can never again allow this to occur. So the good news is we have federal partners on this. And one last thing I'd like to say, when excuse me, when I do my public speaking, and along with folks like Agent Pooh, who's a real hero in this effort, I really bring out how we need to not only invest in the training compensation of this long-term care workforce, but we as individuals need to express our support and the value. And I pose a very simple question when I speak to audiences. How many of you raised your children to be an in-home supportive services worker, a home health worker, or an LVN in a nursing home? How many of us encourage our children or other people's children to get into that profession? With rare exception, nobody raises their hand, but I just bring that out because we need to turn the tables around. It's not just going to Silicon Valley and making $500 million before you're 30 years old. It's also about how we use institutions like the community colleges in Santa Clara County, Santa Clara University, San Jose State University, Stanford, how we get them to start looking at who will care for us when we cannot care for each other. So thank you for letting me be a little passionate about that, because it's just so terrible what's been going on.
That's good. That's we definitely need people who are passionate about all of these issues. So appreciate you both jumping in and addressing this question. Diana, do we have time for one more question, or do we need to move on? You're muted.
We'll do one more question and then we'll move on. So.
Okay, did you have one you have selected? Otherwise, I'll ask Janet Van Zoren's question.
Yeah, go ahead and ask Janet.
All righty, very good. What plans are available, or initiatives or strategies are available in the master plan to address the aging needs of people who have Down syndrome and age about 20 years earlier than their peers, and also who have a very high risk for developing Alzheimer's dementia? Anybody want to tackle that?
I can make a comment, but I think Nina may also want to speak to this. First of all, on the issue of disability, we gave great attention to issues of accessibility, participation, and equity for persons with disability. But I don't think we have quite moved into the great variations in terms of disability. When we talk about that, we're talking about those with cognitive limitations, hearing, visual, emotional, mental health, and physical. And so we have this great variation. But one of the areas that I know we brought up in our particular part, I worked on goal 2 and healthy aging. One of them is also, how do we change the perception, and how do we, we'll use this tech term, rebrand how we view disability and aging? And this goes to the question, for some individuals, the aging process goes much sooner in the life cycle. For others, the limitations that I've described occur much earlier in the life cycle. So I think at some point we're going to have to get to the point where, should we continue to use age 50, age 60, age 65, to define who's eligible for certain services, where those who are in their 40s and 50s or 30s, whether it's Down syndrome, whether it's polio, spinal cord injury, certainly among veterans that are returning with physical limitations, where their aging process is accelerated at an age before age 50. So I don't have an answer to the specific question, nor do I think we addressed it in that level of detail, but it needs to be addressed in the next variations. And so, Nina, maybe you can just clarify whether or not I'm accurate in saying we didn't get to that level of detail quite.
We didn't, but if I could, I know we're getting short on time. There were a couple of questions in the chat I was hoping to be able to answer, so I'm going to try to wrap it all up. One is, it is our goal, people, we know ARP may represent people 50 and over, but people, the last place people want to end up, unless they really need to, is a nursing home. They want to be able to age in community, even with the appropriate supports. So one of the recommendations under area, I think it was area 3, is the creation of an LTSS benefit. This would be a benefit that ARP and 19 other organizations, including disability organizations, Alzheimer's, providers, and labor, we've been working together for 3.5 years now in what will be, we hope and expect, will be ultimately a benefit that folks that do not qualify for other programs can tap into, so that they can pull down some supports. It won't cover everything, so that they can remain at home at least for a period of time. And that benefit, you know, we're still working out the parameters, but we know we have our disability partners around the table, folks that have been disabled since birth. We know that we need to look at a benefit that will allow people who qualify to be able to pull down, and that could include someone, say, for example, with Down syndrome, who's working for a time. Potentially, we're not even at the point of creating that benefit, but ideally this would allow that person to pull down some money for supports and services. So that is a big thing. It was in the master plan under area 3. It mentions federal partnerships. Any benefit is going to have waivers, potentially the new Medicare Office of Integration that the administration is talking about, to bring down some federal matches for a future program. We're just in the beginning stages of this. We need to create a governance structure. There was an actuarial study done last year. We need to revisit that. But I want you to know that's something that is actually ARP's top priority, and it's what I spend about 50% of my time on right now. I also want to address the SNF question really quickly, because somebody asked, what about people in nursing homes? COVID-19 has really laid bare the inadequacies in our system, and the fact that we need to do a lot more to require transparency and proper oversight of facilities. That is another top priority for ARP and our partners, because some people need to be in facilities at least for a period of time. We can't say they're going to all go away, but wherever mechanisms we can put in place to create the environment where somebody can age in place as long as possible, that's where we'd like to head. There's lots of other great recommendations in the master plan for aging about no wrong door, building out the aging and disability resource centers, really exciting stuff. So I'll stop there because I know that we're running short.
Okay, well, I want to thank all of you, the moderator and all our panelists, for doing a great job. You really, I thought about 3 other summit topics that we could do, and people at the end will get to vote on what they think is the topics that they want to hear from in the next couple of times. But we are really looking, caregivers are a really big issue that I think is really getting some attention right now. And I just want to thank you all. You all could be and have been keynote speakers in the past, and we just really appreciate your time and your passion and your investment in our aging community. So thank you all for being a part of this.
Thank you, Diana.
And as you hear, you have a round of standing ovation. Is that what you got from everybody? I want to turn it over to Martha, who will give you some upcoming events to know about, and then you'll get a chance to take a poll about what topics for next time. So Martha?
Thanks, Diana. Okay, good. So we wanted, like Diana mentioned, we want to announce a couple of upcoming events that will be occurring in the next couple of months, in the next 6 months or so. The first is our Home Safe program update. So APS, which is Adult Protective Services, and Silicon Valley Independent Living Center have a grant to prevent evictions of older adults that have been identified through APS. They will be presenting an update tomorrow at the Children, Seniors, and Families Committee meeting. So you can use the link that we've provided on the screen to attend the meeting and hear about these updates. Public comments are also welcome and can be submitted through the process outlined in the website. Next update is our digital inclusion meeting, which Richard spoke about earlier. Our next meeting is scheduled for Thursday, February 4th at 1. We have these meetings monthly. It's the first Thursday of every month. If you are interested in attending these meetings, please email us at seniorsagenda@ssa.sccgov.org for more information. Brain Awareness Week is March 15th through the 21st. The Brain Health Initiative and Seniors Agenda will be offering a brain health symposium in the spring. Stay tuned for announcements and presentations that will be offered to raise awareness regarding this brain health awareness. Older Americans Month. What time is it? Older Americans Month. So the theme this year, it's in May, and the theme is communities of strength. So please show your support for our older American community and share your updates with the Seniors Agenda regarding events that you will be hosting during the month. June 15th is World Elder Abuse Awareness Day. So mark your calendars for June 15th, 2021. The theme this year is building strong support for elders. Seniors Agenda would like to encourage you to all come and support the older adult community as we focus on elder justice. And finally, we would encourage you, if you haven't already done so, to please sign up for our fabulous newsletter. Please go to www.agefriendlysiliconvalley.org for more information. We currently have over 400 subscribers, and we would love to increase that number by the end of this year. We have really great information that goes out every month regarding trainings, workshops, et cetera, and we would love to have you join if you haven't already done so. And before we close, like Diana mentioned, and I'm sorry if it's going a little bit over, we do have a poll in which we would like to find out what your topic would be, what topic you'd be most interested in for our next summit. So if you can be so kind as to indicate which topic, some that were covered today, obviously, would be helpful to potentially have at our next summit. That would help us out.
Yeah, we have
to plan. Oh, sorry, I see another poll here. Yeah, sorry, I think it skipped over poll 3. That's okay. So how useful was the information shared during today's webinar? I'm sure everybody will be putting extremely useful. And I think it may have skipped over a poll question, which is quite all right. We'll figure out another way to get it out to y'all. With the technology the way we have it today, I believe we may be able to send something through Eventbrite. So stay tuned for that. And if you can, please fill out whatever evaluation or if we are asking for any type of input regarding our next topic for our summit, if you could please provide us with that information so we can appropriately plan for next time, it would be very much appreciated. And we have some results for the poll, but I think we'll skip over that. And Diana? Oh, actually, let me just go ahead and touch on this really quick. Our next summit is August 25th. So please mark your calendars. And I think that might be it. Oh, as always, follow and tag us on social media. There's our handles and our hashtags and all that good stuff. Diana, go ahead.
Okay, I want to just thank everyone from all our speakers today for being a part of our summit. We'll be back in August. And I just say, and since we're meeting virtually, if there's somebody that you saw on this summit today in the participants list, or somebody you haven't really talked to or reached out to in the past 6 months or a year, it might be just good to, as an ending to our summit, just increase your social participation by just, reaching out, send an email or calling them up and saying, hi, and I missed you at the summit, and catch up a little bit. So thank you all. And we look forward to seeing you soon. So stay safe and healthy. Take care. Bye.